Let me introduce Professor of Biostatistics, Epidemiology and Global Public Health at the University of Michigan, Bhramar Mukherjee. Professor Mukherjee, it is a pleasure to have you in person in studio in Delhi.
Thank you so much, Karan, and it's a pleasure to be here in person.
Let's focus for a moment on Kerala, because many people today are particularly worried about the situation in that state. In population terms, Kerala is just 2 to 3% of the national population, but in terms of daily cases, it averages 40–45%. Yesterday, it actually touched 50% of total cases. And I believe the R number in Kerala, the government announced this at their press conference yesterday, is 1.2. How worried are you about Kerala?
So Kerala is a very interesting case study for an epidemiologist. So Kerala's R was indeed around 0.7 on June 8th, and now it is around 1.2. The test positivity rate has hovered around 10 to 12% for the last 1 month. So there is no question that we do need to find a way to tap the growth rate in Kerala. But is it all bad? So is it actually Kerala is performing worse than other states which are not reporting too many cases or deaths? So the daily number of tests in Kerala is around 140,000. Compare it to West Bengal, my own state, which has 3 times more population than Kerala, but is doing only about 50,000 tests. So we also have to look at the Sero survey results from Kerala. Kerala has done a fairly good job in preventing and containing the disease. So the Sero prevalence is around 43%. Compare that to the national average of 68%. So also, I think you cannot just look at the number of cases. Kerala is capturing 1 out of 2 infections, whereas all over India, it may be 1 out of 28 or 30. So how can you compare numbers when the testing strategies and the mitigation strategies are actually quite different across states?
What you're saying is that prima facie, the Kerala statistics may look bad. But when you bear in mind that Kerala is doing 3 times almost more testing than Bengal, although its population is 1/3 of Bengal, it's actually capturing many more people than any other state. And secondly, if its seroprevalence is only 43% compared to what's believed to be 68% for the country as a whole, it means that there's a large section of the Kerala population that is still vulnerable because they've been actually well protected up till now.
Exactly. And the other thing I want to mention that we're talking about cases, but we also have to think about case fatality rates. Kerala's case fatality rate is 0.5%. Compare that to 1.3 or 1.4% nationally. So it's 1/3 of the national estimate. So we have to think about the healthcare system.
Which is why I notice that although cases in Kerala are rising, I think yesterday they rose by 22,000, 50% of the national total as a whole, nonetheless hospital beds are under 50% utilized. ICUs are under 50%, ventilators under 50%. So the plus side is Kerala is doing more testing, catching more cases. Its healthcare is better, which is why hospital utilization is so much lower. It's just that because it's taken such good care, it has a much larger number of vulnerable people. So there is a sense in which Kerala is therefore catching up with the rest of the country.
Exactly, exactly. And that's why when we report a national number in India, it's very nebulous because there's so much regional variation. And if we say that everybody has reached herd immunity, that's not really fair because we have to look at the local herd immunity and strategize accordingly. But I'd also have to mention that since cases are growing, we need to have a good sequencing, genomic sequencing network so that we can keep track of the emerging variants.
Because growing cases can lead to mutants and mutations, and you don't want that to happen in Kerala.
Exactly.
But what follows from what you said is that because Kerala is catching up with the rest of the country, what's happening in Kerala necessarily isn't an indication that this is going to happen all over India.
Exactly.
So don't look at Kerala and get panicky. Look at Kerala, dig deeper and try and understand.
And also look at Kerala in a holistic way so that you can look at some of the really model behaviors that the state has adopted.